What is autism spectrum disorder and what does it look like? By Kristen Coffey, Dennis Doherty, and Laura Weissman.
Autism spectrum disorder is a neurodevelopmental disorder which is characterized by persistent deficits in social functioning, communication, and language, and by the presence of atypical repetitive behaviors, sensory sensitivities, and/or restricted interests. The most recent data from 2018 reveals that 1 in 59 children in the US are diagnosed with autism spectrum disorder, and it is 4 times more common in boys than girls. The term autism spectrum disorder encompasses the previously used terms autism, pervasive developmental disorder not otherwise specified, and Asperger's syndrome. It is important to understand that when you are working with a patient with any of these diagnoses, the following information will be applicable. For the purpose of this module, we will use autism to include all.
Although all patients with autism have some level of social, communication, and behavioral symptoms, symptoms may appear differently in each individual. Our mantra is, if you've met one person with autism, you have met one person with autism. What does autism spectrum disorder look like? Often, these patients appear physically indistinguishable from their peers. However, subtle behavioral and communication symptoms may become more apparent upon interaction with a patient with autism. They might have a hard time making eye contact and avoid interactions, or they might be overly friendly and not understand personal space. The patient might have spoken language, or they might be nonverbal. If they do have spoken language, they might have difficulty with back and forth conversation, or might struggle with small talk, jokes, or sarcasm. Patients may have difficulty with sensory experiences, such as certain sounds, textures, smells, or touch. Some patients may have self-stimulating behaviors, such as hand flapping and rocking, pacing or jumping, or repetitive vocal sounds or phrases. It is important to note that these behaviors may be exacerbated during times of stress. In settings like a hospital or clinic, a child may not be able to use these behaviors. This can become overwhelming. Many patients with autism do well with routines and predictability. This can result in greater success in the home and school settings.